The proposed nationwide industrial action of the joint health sector unions and the Assembly of Healthcare Professional Associations did not commence today. This comes after the expiration of a 15-day ultimatum issued to the federal government. At the Federal Medical Center in Abeokuta at the Ogun State capital, doctors were seen trying to make the most of the situation.
At the University of Uyo Teaching Hospital in Uyo and the Lagos University Teaching Hospital, Lagos, normal activities appear to be going on. Patients fill waiting rooms and the health workers are on duty. The Chief Medical Director of the University of Uyo Teaching Hospital gives assurance that management has put measures in place to cushion a strike if it ever gets underway.
Well, I'm pleased to inform you that the staff that are working, they are not on strike. They are still hoping and praying that they should not go on any strike.
The former chairman of JOHESU at the Lagos University Teaching Hospital explains why the strike has not commenced.
There is a meeting going on now in Abuja at the National Secretariat of Medical and Health Workers Union, which is the secretariat for JOHESU at national level. This meeting of today that is ongoing in Abuja will determine if this strike will commence or not.
Meanwhile, at the Federal Medical Center, Abeokuta, the Chief Medical Director, who encourages striking health workers to resume, insists that activities have returned to normal at the hospital.
The maximum effect happened on the first day that they disrupted activities and they locked up everywhere. But from the second day after that, activities have returned back to normal. As you can see, the clinics are running, the patients on admission, they are being taken care of. We are getting extra hand to take care of those who are on admission. The doctors are working fully, the clinics are running.
The chairman of the striking union in the state says the strike is necessary as a tool to return good service conditions to the hospital.
We can no longer stand for the injustice that the Ministry of Health is meting out to us under the leadership of the Committee of the CMDs, which we know we have it on good authority. They are the cabals that the Minister of Health mentioned that have actually infiltrated the 2016 budget.
It is clear that it is in the best interests of the general public that a quick solution be found to the disagreements which exist between the health sector and the government. Mary Alale Yusuf, Channels Television News.
Now we'll be speaking with our correspondent on health, Mary Alale Yusuf, on the story that we just showed you, and that's concerning the proposed nationwide industrial action, which was supposed to begin today. Mary, it's good to have you on News Across Nigeria.
Great to be here, Olumide.
Why the deadlock?
Well, it's not really clear right now why the strike didn't start, but these are the issues. These are the old complaints they've had since some years back now, stuff about having nurses get to the highest point in their profession, stuff about people being called consultants who are not physicians, but who are health practitioners, retirement age being taken up, and a whole slew of things, up to 14 of them.
Yes, which we've heard before.
Yes.
And is there a disconnect between the health ministry with the new health minister that you think that is in charge now, and all these issues that were a problem in the previous administration in handling them today?
Well, it's a really thorny issue, Olumide. It's like this. They have these problems, they bring them up to the government, then the health minister changes. It was Onyebuchi Chukwu, then it became Kaliru Al-Hassan, and then there's a new health minister. So each time it's like, guys, please go back to work, we'll sort this out later. So each time they go back to work and they say, let's give them some time. But I think right now they think that they're being taken for a ride.
And it's in no one's interest, obviously, if this continues, not in the professionals or in the health sector, the doctors themselves, nor the government, because it's the people at the end of the day who are suffering.
Oh, yes.
And the government also, people makes up the government as well.
That's right.
So this particular 15-day ultimatum, what is the major grouse or the major reason do you think that they didn't proceed with the strike action?
It's simply this is a body of issues. They believe that the courts, the industrial court, has ruled on certain things which the government is not following through on. The industrial courts, according to them, have said, these are the things we want you to do. Go ahead and do them. But they are not seeing, according to them, any reciprocal action from the government. And so these are the issues that they're talking about. It's not quite clear now why the strike didn't start yesterday.
Yeah.
But they did go into a meeting in Abuja, and they said at the end of that meeting, everything will be made clear.
And Mary, obviously finance is a major bone of contention concerning what the doctors' demands are.
It always is.
And we saw the minister of Professor Isaac Adewale at the Senate the other day asking for defending the need for more money, or that the budget has to be in line with what they need. As far as that is concerned, do you think this is the economic crunch as well makes it hard for the government to meet these needs?
Well, it is very possible, because up until now, the health workers complain that infrastructure is a big issue. They don't have instruments, they don't have equipment, and they're also talking about training, that training just has to improve. So it all comes down to money, 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 and more money.
Okay, and we hope that they will find there's a speedy resolution. It's a major issue. You talked about infrastructure. There's some long-term investment that needs to be made in the health sector. So it's not just the CONMES salary scale.
Oh yes, obviously.
No, it's not just that.
There are
alone.
long-term issues, short-term issues.
Short-term issues, but we hope that concerning the shorter ones, as far as unpaid salaries are concerned, that is quickly nipped in the bud.
Of course, in the interest of the public.
Yes, indeed. Thanks, Mary.
My pleasure.